Our final speaker is Dr. Edward Wilson, who is the Miles Professor of Ophthalmology at the Storm Eye Institute at the Medical University of South Carolina. And he will be speaking to us today on patients with disabilities.
Thank you. It's a privilege for me to be included in this. It's a very important topic. I was asked to speak on communicating with patients who are adolescent or young adult with a disability. I'm a pediatric ophthalmologist. I do see a lot of patients with disabilities and even adults with disabilities. I bring some credibility because I have an adult son who's disabled and uses a wheelchair and has low vision. And so I can speak as a parent as well as a caregiver. And I can tell you that parents and patients will recognize whether you are a practice that's friendly to persons with disabilities or not. And you really want to learn how to be very comfortable and be categorized as welcoming to patients with disabilities. These are my financial disclosures. So I'm going to share some general tips for communicating effectively with persons who are disabled and introduce people-first language, which you may not have heard that term before, and to share some feedback from patients, from my patients, with disabilities on how they think your communication should be improved. Now, people with disabilities, I like to refer to them as people with other abilities. They have as many varied interests as those of us in the room. They have a lot of abilities, a lot of things they can do well. It's 54 million Americans who have a disability. It's the largest, most inclusive and diverse minority group we have. So use people-first language. This is very important in the disability community. You don't want to define, the disability doesn't define the individual. It is a man who uses a wheelchair, not someone who is wheelchair bound. You don't want to talk about the Down syndrome child. You want to, it's a child with Down syndrome. And that seems like a small point, but it actually isn't once you get further into this. Also avoid some of these terms like afflicted with, confined to a wheelchair, poor vision, suffering from, or handicap. Handicap is a word that actually means cap in hand. It has an origin of those beggars on the street with their cap in their hand. It's not a term of endearment in this community. You speak about a person who is blind. Might also be a person who is a dancer, a person who is an artist, a person with a communication disorder, a person who has cerebral palsy. Now, here are a few things, and I have a whole list that wouldn't fit on the slide. Advice to you from them. Talk to me and ask before talking to my support person. How often have we made that mistake? You make a quick assessment when you come into the examination room. There's an individual who may be an adolescent or a young adult or older adult. They have a caregiver with them. And you don't want to make the mistake to immediately start talking to the caregiver. Now, it may be appropriate to talk to the caregiver, but you speak to the patient and ask the patient whether you should be communicating with them or with the caregiver. Take me seriously. I know what I like and what I don't like. Now, if your patient is like my son, he is much higher functioning receptively than he is expressively. So he can understand a lot more than he's able to express in the time that you give him to express it. These patients want to be taken seriously. They know what they like. They know what they don't like. You can ask them if the room's too crowded, if they would rather see you without all the medical students. And please tell me what is going to happen next. Short sentences, ask them if they understand, talk in more concrete language rather than in language that might be harder to understand. And don't make any assumptions just based on their appearance on what they can do and what they can't do. You really want to be comfortable with individuals with other abilities. I think one of the reasons that I see a lot of families and even adults who have disabilities is because I'm just comfortable with them. And they're incredibly interesting people, and even someone with a disability that's fairly profound, often they have ways they communicate. They have abilities that you should recognize, and even if you have to mostly talk with a caregiver, you just learn to be very relaxed with them. Do identify yourself before speaking to someone with a visual impairment. Don't lean or hang on to a person's wheelchair. So the assistive devices are part of that person's body, and respected as private property. Do treat adults as adults. You want to talk in a normal tone of voice, and then you can develop a communication plan and a strategy that's right for that individual. But initially, treat an adult as an adult. And you don't have to be sensitive with patients that are blind. You don't have to be sensitive with phrases like, see you later. General guidelines, talk to persons with disabilities in the same way you would talk to anyone else. And then you can start to adjust your strategy as needed. You don't need to shout to them, speak in a normal tone of voice. And I would always, regardless of how profound the disability is, I speak to the patient first before I speak to anybody else in the room. And if they're in a wheelchair, sit down quickly. Get at eye level with the patient. That was mentioned before. You don't want to be standing over the patient. You want to get down at their level very quickly. And ask the person with a disability if assistance is needed. Don't assume that they need to be rolled out of the room or that they need to be helped into the examination chair. Ask them first. It's amazing sometimes you are under the assumption that you're going to need to have an army here to help them into the wheelchair, and they jump right out of the wheelchair and into the examination chair. And don't pretend to understand. The patients tell me that, don't just nod, and if you can't understand my speech, just say, I can't understand you. Could you repeat yourself? That's okay. A lot of people are so embarrassed by that they hear the mumbled words and they just nod and they just sort of pretend, and the patient knows exactly when you're trying to fake it. Be patient and listen. These patients take more time. That you have to be prepared for that. Don't complete the patient's sentences. A lot of these folks take longer to get the words out. And they would like to at least have a little bit more time to get those words out. So be patient with them and don't try to finish the sentence and very quickly. Short questions that require brief answers or even a head nod. They need your undivided attention. You can ask them, it's okay to ask them, how best do you communicate? How do you want me to interact with this communication device if they're using a board or something? And then you can develop a strategy. It's really nice when you see these patients over and over again because you can develop a strategy and you're very comfortable from the beginning on how you're going to emphasize their abilities and not their disabilities. And recognize that a lack of effective and appropriate communication in this community is a real barrier to the delivery of quality health care. If you look up studies that have surveyed patients with disabilities, they are very unhappy with their communication with the healthcare providers oftentimes. So in summary, persons with disabilities are the nation's largest and most diverse minority. Developing a strategy for communication will improve the delivery of health care for all of us and use people-first language and learn to be comfortable with those individuals that have other abilities. Thank you.